Friday. As y'all see the topic today, I'm going to be giving tips, on cosmetic surgeons and post-operative care, how to find, and how to find and research a good surgeon and the difference between a cosmetic and a board certified plastic surgeon. There's definitely a difference, and it's important for, us ladies to do our research on these surgeons. So I want to say salute to everybody first. Hello, Dragon. Salute, Timothy. Salute, True Speaker Smith. Thank you for chiming in. Salute, bro. It's WeTV. Hey, Miss Parker. So I hope everybody Friday afternoon been well. So, ladies, if y'all I would like for y'all to go and grab y'all pen and pad. Hey, Troll Gang. And fellas, if y'all listening, y'all lady, she's interested in getting cosmetic surgery. I want y'all to take notes for her, y'all sister, y'all auntie, y'all grandma. Like, just, I'll be dropping some gems. So I just hope y'all really take notes, because this will definitely be some valuable information. So I want to, pretty much speak to my ladies right now. I know there be like a lot of, people, they judge you because you go get, cosmetic surgery. They say, well, you have low self-esteem, but I'm all for it. Like, if you don't like something on your body, if your priorities and you got your priorities in order, you got the money, fix it, like, I'm all for it. So don't never be ashamed to what you want to do to your body. It's your body. Don't let nobody, influence you not to do it if that's something that you want to do. And some women, we want our bodies back to our pre-pregnancy weight. Like, they don't understand we go through a lot. We bear kids, and those muscles, they get stretched. In which people like, well, just go exercise. It's not that easy. It's not that easy at all. So it's easy said than done. So the stretching of the muscles, which causes a bulge in our stomach, which is called diastasis rectus. So it's just pretty much a separation of the muscles. So I'm gonna show y'all, a picture of what I'm talking about. Salute to everybody in the chat. If I haven't spoke to everybody. So these are the different stages of diastasis recti. So it show you the normal of how the muscles should be before pregnancy. And then you have the open diastasis, to where those muscles are stretched. So there's different kinds, which is listed below. You got the open navel, and you got the above the navel. So when we have babies, or we go through this here, like the bulge in our stomach, so we still continue to look pregnant even after giving childbirth. That's just because when they went in and we delivered the baby, or if they cut you like during the C-section, those muscles are stretched because they had to go through the different layers of skin to pull the baby out. So sometimes exercising, it does not help. The muscles have to actually be repaired, which meaning a tummy tuck, which you can go in and you can get those muscles stitched up and then get the loose skin cut to go back to pre-pregnancy weight. So just want to give everybody a little understanding of that. Salute, Troll Gang. Let's see here, y'all. I'm kind of paying attention to the comments. I want to get through this content. But salute to everybody that's coming in. I appreciate y'all chiming in. Y'all could be anywhere, but y'all here. So, like I said, it stretches the muscles. And sometimes exercise, it doesn't work for some people's situation. So, which causes them, to get a tummy tuck. So then even with the stretch muscles, on the diastasis, us women, it allow us to have it causes back pain. You always feeling bloated, and also incontinent of urine. That means you might leak. So that's why, ladies, it's important if you experiencing this, you do your Kegels exercises. You do your Kegel exercises, and it also can cause constipation as well. And you don't want to be constipated. That's not a good feeling. So, I'm not trying to discourage you, ladies, who is suffering this, but I'm sorry, I can't talk today. Who is suffering from this? You can try to exercise, but most people get this situation corrected by surgery, which is a tummy tuck. So I want to show y'all the difference. Let me show y'all another photo real quick. So this is diastasis recti again. Y'all see on this first picture how the muscles are separated. And then do y'all see the picture in the back? That's how it's supposed to be. So by the muscles being separated, it causes the bulge in the front of our belly. That's why if y'all seen women that walk around, they look pregnant, but they're not. That's just the rectus of the abdominis, which is just the abdomen, and then the rectus just meaning muscles. They separated, so it causes your belly to bulge. So y'all see the line on the bikini line right down here? That is the incision that the surgeon will make. They'll stitch the muscles back together, so it'll look like the picture in the back where it says normal abdomen. They stitch the muscles back together so you can feel that tightness and the muscles aren't loose anymore. So that's just the difference between the two. So I wanted to share that with y'all. Yes, definitely look into it, Miss Parker. Especially if you done, you finish with having kids and stuff. I don't see nothing wrong with plastic surgery. So a lot of people say, it's a problem and people, have low self-esteem. I feel like if you don't like it, you got the money to fix it, then fix it. So ladies, I also want to get into some research, when you go looking for a plastic surgeon, I want y'all to know the difference between a cosmetic surgeon and a certified board plastic surgeon. Some people, they don't know the difference. That's why it's very important for you to go do your research before you just go to any doctor or any surgeon or whatever. So a board certified surgeon that actually took an exam, they have a board certification, and they have to complete a clinical, it's a residency they have to complete in order to be eligible, and they had so many required training, and they can operate in a hospital setting. A cosmetic surgeon in most states can perform any cosmetic procedure. So any doctor that's in that just works in a hospital, he can title himself just as a cosmetic surgeon without the required training, or not having to take a residency, or not having to take the board certification like a board certified surgeon. So the best route to go is a board certified surgeon. So I hope y'all taking notes for whoever out there that's interested in getting surgery. This is some valuable information. So please, 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 when you do your research, make sure that you ask the surgeon, is he board certified? That's very important. There's a difference between a board certified surgeon and a cosmetic surgeon. A cosmetic surgeon is not a board certified surgeon. So that's important to know. And then who wouldn't I would want someone that can operate on me in a hospital setting, not just at a little clinic, So So like I said, in most states, a certification isn't required for physicians. Like they can just go and be a cosmetic surgeon today. So the kind of surgeries that a cosmetic surgeon can perform is a BBL. They can do tummy tucks. They can do breast lifts, breast augmentation, and so forth. So just imagine this surgeon, he's just a cosmetic surgeon, and he's performing all these big surgeries on somebody without having, the required training or not being certified and not going through the residency and all of that. Like, that's kind of scary. So just keep that in mind. And the next, when you're researching, cost plays a part. And I want to stress this to my ladies. Please don't go the cheap route. Like, the cheap route is not always good. This is your body. Your body is your temple. You only get one. So please invest in your body. Like, it's nothing to play with. Like, you don't play with your body. So don't always go the cheap route. You might have a doctor, but I see a lot of them, surgeons, they do have like deals to where they doing like a mommy makeover for $5,000, or you got them saying like, oh, I'll do a tummy tuck for $2,000. So me, I'm the type of person, I'm gonna go with that higher price, because if you know the saying, you get what you pay for. You can go to the surgeon that has, that's only charging $2,000, but then you come out and your body is botched. Slew powder puff, and your body is botched. So then you will have to find another surgeon to correct that problem, which you're going to come out paying more expensive. Like, it's going to be way more expensive, especially if a doctor had to correct what the other doctor did. So like I said, just invest in yourself the right and the safest way. And like I said, you keep in mind, you get what you pay for. And then to prevent, like, getting botched, like, all you have to do is just like, when you research, you find you a surgeon, you research the surgeon, put their name in Google. And another valuable information, when you're researching a surgeon, you also have to be mindful that even if they had a death on their record, they probably went and changed their name. So that's something you have to be mindful for. So when you put their name in Google, you read everything until there's no more pages of this doctor, this surgeon that you can read on. You go to the website and you read the reviews. If they have social media, you go on their you go on the YouTube channels, you go on their Instagram. And then also I advise y'all to get in these Facebook groups, because today a lot of surgeons, they got a lot of Facebook groups, even if it's just women that had surgery, and they create a group of women that went to the same surgeon. So I also advise you guys to get in these groups and type in that doctor name and find these groups and see what these women are saying about these surgeons. So even as a particular surgeon that you looking, to get surgery, type his, like, even if you're shy and you in the bushes and you don't really want to ask questions, you go to your search engine in that group and you type in what you want to know. 9 times out of 10, you're going to pull up everything that, because I'm pretty sure everybody want to know the same question. So it's going to pull up that question of people already asking whatever you wanted to know. And then you just read, what people say. You just, and then once you not afraid, then you come out the bushes, and start asking women, like, how was your experience? So that's another thing to be mindful. And then also, there's also a website to check to see if a surgeon is board certified, and it is called the American Board of Surgery. So all you do is you'll go on there and you will type the surgeon name in the search bar, and then if the name pop up, then you know that surgeon is board certified. So I'm gonna put it in the comments. So this is the website that you go on to see if a surgeon is board certified. So that's the website you will go on, and you type in a surgeon name, whoever you're interested in, to see if they're board certified. So that's another thing, to keep in mind. But like I said, a lot of these surgeons, they do have deaths and they will change their name too. So it's just, that's why it's very important for you to do your research. So, and once you feel confident, you found the surgeon that you would like to move forward with, then you have to, come up with your questions. Like, it's okay to ask questions. Ain't no question is a dumb question. So if you don't know or if you don't understand, please ask questions, because this is your health, this is your body, and this is your money that you invest in. So it's like, I'm gonna tell you guys a few things that you need to, to do and to know before surgery. Please, 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 please be honest about your medical history. Like, you have these women, they will lie, and then they so pressed to get these surgeries, and then it don't go well. So please be honest about your medical history. If you on birth control pills, like, the surgeon need to know that. If you have high blood pressure, if you had diabetes, because if you have diabetes and you get these surgeries, that can interfere with your healing process, because as y'all know, being a diabetic, it's harder for a person, to heal. If I get a cut, like, I heal fast, but if a person that has diabetes, they get a cut, the healing process is slower. So they need to know that. And high blood pressure, that can also be an issue, because that needs to be under control before you get your actual surgery. And also, any heart conditions and birth control definitely should be stopped before you have surgery. And also, your family history, like your mom history, your dad history, or have anybody had like a reaction to the anesthesia too, because that's important as well, because you will be put to sleep during these procedures, and they'll have you sign a paper saying that you can die from anesthesia pretty much. But they said that the chances of like a 1%, like, you have more chances of going outside and getting hit by a car before you actually pass, over going under anesthesia. But if your family ever had a problem with anesthesia, that's something also that you will need to tell your doctor as well. Like I said, your medical history will definitely play a part, like, in your overall healing process. So I'm gonna just tell you guys, some questions that y'all can ask the surgeon. How long is the surgery? Like, whatever you looking to get, you trying to get a tummy tuck. You ask questions like, how long is the surgery? And the things that you need to do, like how long you should be on bed rest, or how long you should stay off your feet. So just ask these questions so you can be mindful, and that also will help with your healing process. And then, like, during surgery, like, if you don't know, ask, like, who's in charge of keeping track of my vitals? Like, who's monitoring that? And then, as you know, post-operative care is as important as, researching a surgeon, because post-operative care, that's when you're more prone to like getting infections and things like that, because then after surgery, depending on what type of cosmetic surgery you get, you have to get the drains, because you need the fluid to drain. And and the massages are important too. And then also, there are some things that you could ask about before surgery, like the epidural shot. It's kind of like a lidocaine. Y'all know how we go get our a tooth pull, and they get it with the lidocaine, which numbs the gum so we can't feel it. It's similar to that. A lidocaine shot is called an epidural shot. So you can ask your surgeon if they offer that. So they kind of numb the areas where you're getting surgery. I think you get it in like 4 or 5 places. Like, say if you're going for a mommy makeover, you can get it in your breast, you can get it in your tummy, you can get it in, you can get it in certain areas. So that's also mindful to ask about the epidural shot, which will kind of take off a little bit if you happen to always pop the narcotics, which can cause you to be constipated. So that's why it's also very important to take stool softeners. It's also important to take stool softeners Sorry, y'all, just took a drink. But it's also important to take stool softeners during your healing process because you're taking these narcotics, which causes you to be constipated. So you don't want to have to experience being constipated and then you just got a tummy tuck and you have stitches and then you on the toilet straining and that's not a good combination. Then you're ripping over your stitches because you straining, you trying to use the bathroom. That would just be ugly. So I just pretty much, I stress enough. Drink water, take stool softeners. That's very important. Also, walking, walk. I'm not saying 2 days after you have your surgery or a day after you go and you walk a mile down the street. No, I'm not saying that. Get up. Do not lay around after surgery. Do not lay around. Get up, as much as you can, and gradually when you start to feel better and your pain medicine start kicking in, get up and please walk around the house, not outside. So yeah, get up and thank you, AZ King. Salute to everybody in the chat. I'm watching the chat, but then I'm trying to get through this content. But like I said, walk. I can't stress that enough. And then also make sure you have on your TED hose. If anybody not familiar with TED hose, they just like compression stockings. It keeps the blood circulating through the body, and also it can prevent blood clots. It can prevent DVT in the legs. So I want to talk a little bit about that. I got a picture to to show y'all about that. It's just to be careful. It's dorsiflexion. It's the Homan signs, which you would dorsiflex, like bend your leg. And if it's painful and if it's hot and if it's red, that could be a sign of a blood clot. So that's an emergency situation. And please, if this situation is going on with you, please do not massage it because it could dislodge and go into your lungs, which will cause you to have a pulmonary embolism, which is a blood clot in your lungs. So please, in a situation like this, please do not massage the area where you suspect a DVT, which is just a blood clot in the lung. Please don't. So you will just pretty much just lay back and you will bend the leg up in the air. And if it's painful, it's hot, and it's red, it could be a chance that you have a DVT. So you need to go to the emergency department as soon as possible. So, see this one. Yes, we definitely need this on Black YouTube. So since I got that out the way. So another thing I want to let you guys know. Just know before surgery, the certain, like, you have to fit a certain criteria. I know we have some women that's on the heavier side. So you have a doctor that will actually turn you away because your BMI is too high. So me personally, I feel like to have the best results, try to lose weight first. To get the best results, because you're investing in your body and you're spending all this money. You don't want to, hey Cam, salute Cam, you don't want to invest your money into your body, but your stomach flat, but your shoulders still look big. That ain't a good look. Or you don't want to invest in your body. And then some women, and it's the other way around. Some women, they get these BBLs, but their legs look skinny. So now they walking around with these big booties, but they look like ants. So it don't look right. So you got some doctor that will tell some women that they're like too thin for a BBL, but then you have some doctor that does skinny BBLs. So it just all depends. Or you have some doctor that may tell someone like, well, you have to gain 10 pounds before I can do your BBL. Then you have some women that don't have fat to take away from the belly to put in in the butt. But then you have some women that have too much fat and the BMI is too high. So the surgeon will only allowed to do, okay, say if a woman, her BMI is really, really high and she wants to get these multiple surgeries, she wants to get this mommy makeover. The doctor may say like, well, I can't do this surgery because your BMI is too high. I can only do this, this, and this, or I only can do your tummy tuck, because they feel like the heavier you are, the more risk that you are for complications. So that's why it's important to have a decent BMI and to lose weight before surgery. I mean, if I'm investing in my body, I'm gonna have to lose some weight. If I'm a heavier woman, because I want it to look good. Like, I don't want to waste my money. Like, I don't want to get surgery. Then, like, you got what done? Like, you can't even tell you had surgery. So that's what a lot of women, they be so in a rush to get these surgeries, and they don't look like they had nothing done because they didn't take the proper steps as far as losing weight, getting on a diet. They just want to take the easy way out and just get the surgery and think it's going to make them look like a Barbie, and it's not true. And then you have some women that don't do their research, and they go to these doctors, and Dominican Republic don't do their research. What the stipulations are different over there than it is over here. Over here, they only allowed to remove so much fat. And in Dominican Republic, it's totally different. So then they come back. They went there because it's only 2,000 here. I mean, it's only 2,000 Dominican Republican, but then it's only like 6,000 here. So they took the cheaper route, and now they drop dead gorgeous, literally. Like, so you just have to be mindful. And then also the things you have to complete before you go to surgery. You have to get your labs drawn 30 days before. And iron is definitely a big deal. Like, I know a lot of people that are anemic. So I know low iron is a big one for a lot of people. So there's a list of foods that's high in iron. So with your iron supplements, you can always, you can also eat liver, which is high in iron. Greens, spinach. We got broccoli and we got beans. All those foods are high in iron. And then, you have to take other series of tests, chest x-rays, depending on the type of surgery you'll be getting. I'm sorry, y'all know my baby loud in the background, but so you have to take different tests. So now I touched on that, and I, talked about how important that the tail holds compression socks was. And then also about the stool softeners, make sure you're taking those because the narcotics can make you constipated. And then also it's important to have a support system too, as well. If you're going to get these surgeries, like, have a support system, because that's definitely very, very important. And then you need comfortable and loose fitting clothing. It's another thing that you need. You don't want nothing tight, and you just got stitches and you already barely walk. So loose fit clothing is the best option. So even a robe, and then you got the drainage tubes that will be hanging. So you have to have comfortable clothes. And then depending on like the surgery, like some women, they get a BBL, you need a BBL pillow. And me personally, I recommend Pro Healing, which is good for wounds. So I'm going to type that in the chat. That's something that you can get from like Walgreens. They sell it over the counter. You don't need a prescription and nothing for it. It's called Pro Healing. It's good for wound healing. And you will have like wounds from where you get cut from. So you got to make sure you're also changing the bandages on that, especially if they are soiled. And also paying attention to the drainage. Make sure ain't no foul smelling drainage. And also pay attention. If you have a temperature, this can indicate that you have an infection, which you will have to contact your doctor ASAP. So that's why it's very, very important to follow your doctor directions before and after surgery. Even though the anesthesia, they tell you do not eat after midnight. Please follow those directions, because they tell you that the importance of that, because during surgery you can aspirate, like you can die, like if you eat. So when they tell you do not eat after midnight, please do not eat. Then they may have you wash up too, take a bath with the antibacterial soap wherever they're gonna be doing, the surgery at, just to keep down the of you catching an infection. So if you're on any birth control, like please just ask the doctor when can you resume, after having surgery, and when are you supposed to stop. I believe it's like 30 days before you have your surgery. So it's very, very, very important to follow the doctor's directions to prevent complication. But like I said, post-operative care is just as important as researching the doctor. So like I said, make sure you change your bandages. Make sure you ring your TED hose. Make sure you're walking periodically. And then also you have people that travel to go get surgery. You got people that go to Miami. They go all over. So even when you're on the plane, like please make sure you have your TED hose on. The altitude is high. So that's going to cause you to swell up anymore, like even more. You just had surgery. So you're going to swell up. So that's why even on the plane, you need to get up and you need to walk periodically. I don't care if it's you walking back and forth to the bathroom, just walk. Walking helps, it helps with the blood flow, and it also prevents blood clots. So we talked about, how to check for the blood clots, the DVT in the legs, you dorsiflex. So when you lift your leg up and you bend it, dorsiflex. So that's just the bending of the leg. So I show everyone a picture of that. And also after surgery, your doctor may prescribe a Lovenox shot, which is just it's a blood thinner shot that you will have to give yourself, which is very important too, because that also prevents the blood from clotting after surgery. I know these shots can be painful. So one tip I have for that is when you finna give yourself the shot, you pinch the fat. So you will give it, I would say, like near the side of your stomach, you pinch the fat and you rub the alcohol, but you have to let the alcohol dry because it's going to burn. That's what some people, they're like, oh, that burn. They're not letting the alcohol dry. So you let the alcohol dry completely on the skin before you puncture yourself. So you will wipe it with alcohol. You will wave it to let it dry completely. And then you will puncture yourself and give yourself the Lovenox shot, which I know those shots are painful, but it definitely will help with the clotting. So like I said, and the doctor will also prescribe narcotics. So it's also important to take stool softeners because you don't want to be constipated. It's not a good feeling. So I know everybody pain tolerance is different. Like I have a high pain tolerance. So you got some people that had surgery and they all bent over like, oh, I can't take this too much. So depending on your pain tolerance, and if you can tolerate it, get up and walk. Like just walk. That's the biggest thing. And then walking can also prevent constipation as well. Hey, Mink. So please, after surgery, please just don't lay in bed for days. Please don't do that. Like I'm begging y'all. If you can get up and walk, please walk. Do not lay in bed for days. Not walking outside. So like I said, I stated some signs of infection as well, like temperature, you have a fever, and then like the wound area wherever you got your incisions at, if they hot, the area is warm to touch, a foul smelling discharge can also mean that you have a infection. And just to contact your MD so that concludes that topic. Like, I'm taking any questions. Hey Mink, I think you have a cosmetic surgery. If you don't mind, can you come up here and talk? I want to know what your experience was like, if you still in here. So I'm gonna drop the link. So I just wanted to get that out to my people. Y'all share this live if y'all can, please, because my women, y'all, it's been a lot of women that's dying over these plastic surgeons all because they didn't do their research. And it's important to do your research on these plastic surgeons. It's definitely important. So if anybody have any questions for me, Mink, if you still in here, can you hit the link if you have time? So yeah, it's definitely important. I apologize if I went too fast, but I had to get this message out to my people. So if y'all could share this live, y'all can watch the playback. I just want my people to be educated, because some people, they not educated. And in the day, I don't mind, dropping these gems. I don't mind passing on what I know if it can prevent, something bad from happening to somebody. So if anybody have any questions, you can hit the link. And Mink, if you're still in here, can you hit the link? If not, I'm going to end this live. I just wanted to get this message out to my people. Like I said, share this live, take notes. I hope y'all took notes. I know it's a lot of people in the bushes. So if y'all took notes, just definitely, I thank you, Goon. Salute, no sound. Thank you so much for sharing it. So yeah, hope y'all took notes. So Mink probably just passed by. She probably ain't here no more. So y'all, thank you, Goon. So I'm gonna end this live, y'all. Just wanted to get that message out to my people. I don't see no questions in here. My bad, y'all. I was just talking. I probably didn't get to speak to everybody. Hi, I am the streets. Powder Puff. That's scary to think about. I will only want someone who's certified to do surgery the right way. Exactly, 1K. So you don't have children so you can't have children after having a tummy tuck. No, you can still have children after having a tummy tuck. You can still have children. When I was younger, I wanted to get my body done, but then I grew up and my body filled out, and now that scares me a little. Yeah, puberty. Yeah, growing does hurt. Can be painful. Yes, Miss Parker, you definitely should look into it. All right, thank you, Goon. Salute DJ, Troll Gang. Okay, y'all, I'm in this live. Thank you, 1K. Thank you so much, sis. So y'all have a great day. And please take this valuable information. Send it to a friend. Send it to a friend. And I'm out, y'all.